Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith-Rogers. Today, attacks on healthcare and healthcare workers around the world. Professor Joe Amon is director of the Center for Public Health and Human Rights at the Johns Hopkins Bloomberg School of Public Health. He speaks to Dr. Josh Sharfstein about a new global report on violence against healthcare in conflict. A note that these podcasts are a conversation between the participants and do not represent the position of Johns Hopkins University. Let's listen.
Professor Joe Amon, it's great to have you back on Public Health on Call. How are you doing today?
Good, and I'm glad to be here.
I am going to ask you about this new report that has just come out called Epidemic of Violence, Violence Against Healthcare in Conflict 2024. Can you tell me about this report?
Sure. So this is a report that's put out by the Safeguarding Health in Conflict Coalition. It's a group of academics, of practitioners, of professional organizations for nurses and doctors who all came together more than a dozen years ago now to express concern about the fact that hospitals, clinics, health workers were being targeted, kidnapped, killed, and really, there was very little attention to that, and there was very little data being collected about how frequently this was occurring, what types of attacks, how people were being attacked. And we came together to start doing an annual report about the phenomenon and to track trends and what was going on.
Before we get to the findings of this year's report, could you tell me a little bit more about the human rights framework that this report fits in?
Sure.
Where do you see the particular problem in violence against healthcare?
So I think there's two different frameworks that are important to keep in mind. One is international humanitarian law, which is really the rules of war. And it talks about the fact that healthcare workers, health facilities, schools are places that are civilian entities and should not be targeted and should not be attacked. There's, occasionally some cases where, a school or a hospital can be taken over by a military force and turned into a military base, and then the rules kind of change. But the basic conditions, the basic rules are that these should be protected. And this came about because of real atrocities of civilians being targeted, of healthcare workers being targeted, and an international agreement that shouldn't occur. So that's one framework. The other framework is that governments around the world have an obligation to ensure that people have a right to health. And when health facilities are attacked, there isn't just an impact on the health workers, there's also an impact on the surrounding community that depend upon that healthcare structure, whether it's a hospital or a clinic, a vaccination campaign. And so interfering with those functions and with those activities interrupts people's right to the highest attainable standard of health.
So in other words, there could be a number of people in the community that get their medicines from a healthcare facility. If it's bombed, then all of those people suffer.
Absolutely. That's exactly right. And beyond just healthcare facilities, there's also concern about social determinants of health. So we could be also talking about water sources, or we could be talking about sewage systems, or we could be talking about other things which, if they are targeted, become the cause of ill health for populations.
Let me ask you about this group that has come together for about a dozen years, you said, to collect data. How do you go about doing that?
So we partner with an organization based in Geneva called Insecurity Insight and use a monitoring system, which is a combination of looking at events that are reported on in the press and trying to confirm the specific details of what's happened. Also, humanitarian organizations that are working in different countries around the world will report directly to the organization and say, these are the things that happened. And then we have a long process of validating the data we have, putting it into a public access database that people can access to look at specific cases, to look at specific trends over time.
So this is a lot more than a Google search.
It is definitely a lot more than a Google search. Although when we started, it was a similar but much smaller scale operation where we were doing a mixture of kind of Google search, reaching out to ask people if this information that had been reported was correct. And then it's really scaled up in the dozen or so years since.
I want to ask you about some of the findings from this year's report, and we'll start with Sudan. 276 reported incidents of violence against or obstruction of healthcare in 2024. What's happening there?
So Sudan has had a longstanding conflict that is really in the top conflicts globally where we're seeing attacks on health. In particular, there's some tensions between the north and the southern Sudan. And so what you find is incursions, border conflicts, and indiscriminate bombing that sometimes incidentally targets health facilities and sometimes intentionally does.
I'm reading here that in Sudan, health facilities were damaged at least 79 times in 2024, which is up from 2023. And at least 66 health workers were killed in 58 incidents, including ambulance drivers, doctors, medical students, nurses, pharmacists, and vaccinators.
Yes, that's right. And the rapid support forces in Sudan were responsible over a 6-month period in 2024 of shelling hospitals, of airstrikes. So this isn't small scale. This is really a systematic targeting of health facilities in Sudan.
Let's go to Myanmar with 308 reported incidents of violence. What is going on there?
So in Myanmar as well, the Myanmar Armed Forces has occupied hospitals, and with their occupation, there's sometimes a backlash where other parties in the conflict then attack the Myanmar Armed Forces, and the consequence is that the facilities are destroyed. People can't seek healthcare at all. There's been a long process, or there's been quite a few drone strikes of hospitals and attacks on health workers specifically because they were often very vocally protesting the actions of the Myanmar government and were seen then as partisan forces.
Before I continue to ask you about other countries, what is the goal of a report that tells these stories?
The main goal is to really try and make sure that international humanitarian law is followed. There should be respect for how wars are conducted and ensuring that civilian parties to the war are not targeted. And so I think that's the main goal. There was a real effort to also work with the World Health Organization, with the UN Security Council, to get more attention so that military, armies, actors could get a better understanding of the rules of war. You know, they may say, oh, we weren't aware that this was a violation of international humanitarian law. And so there is a need to train forces to ensure that people understand what the rules of engagement allow and what they don't allow.
Right. Let's go to Ukraine. What is the status? I certainly remember in the early part of the war, there was enormous damage to hospitals there.
Yes, Russia has been responsible for targeting range of hospitals, including maternity hospitals, general hospitals, clinics, indiscriminately targeting cities with drone attacks. There have also more recently been attacks on hotels where journalists stay. And you can see from this range of different targets that these aren't legitimate military targets. These are ways in which Russia can try and dominate and try and stifle reporting on these events and punish the civilian population.
Yeah, I'm reading that as of July 2024, 127 health facilities in Ukraine were fully or partially damaged, and 505 were non-functioning as a result of conflict. That is an enormous amount of harm.
Absolutely.
Let me ask you about the number one location for attacks on healthcare in this report, which is the occupied territories. 1,361 documented incidents in 2024. Tell me what is going on there.
What's going on is just a widespread, massive attack on Gaza that's affecting clinics, hospitals. 90% of Gaza's population has been displaced. And there's also been a siege in terms of allowing in humanitarian aid. Hospital health workers have been arrested. They've been killed while in the hospital. Patients have been killed. It's ongoing. There's still just a massive humanitarian disaster occurring there.
There's a widely reported incident recently of emergency workers being shot in Gaza.
That's right. And these were emergency medical technicians in an ambulance with lights on, with a UN accompaniment. And they were killed one at a time, shot in the head, and then they were buried along with their ambulance.
Now, Israel has, I think, acknowledged some responsibility for that particular incident and said it's under investigation. But in other cases, Israel has said that some of these attacks on healthcare are because the hospitals are harboring Hamas, which of course is responsible for the attacks of October 7th. How do you view that from the context of this report and a human rights perspective?
That's right. I mean, the October 7th attack by Hamas was also very much a war crime. But the rules of international humanitarian law aren't that any presence of military within a hospital means that the hospital is now fair game. Armies, military actors have to consider what the impact of taking out a medical facility would be, what the advantage of it would be, what the proportional or disproportionality of the attack is to larger goals. And the extent to which there are Hamas militants in hospitals is not entirely clear. It's not been, in anything that I've read, conclusively shown that they are operating from hospitals as military posts. And the consequence in terms of both the loss of life of healthcare workers, of patients, but also the long-term consequences of the total destruction of health facilities within Gaza is of a huge importance and huge damage.
In that particular case, Israel did acknowledge errors, and I understand is still investigating. But in other cases, Israel has said that the attacks were justified by the presence of Hamas in the hospitals, Hamas being the organization responsible for the attacks on October 7th. How do you consider that justification?
Well, absolutely, the attack on October 7th was also a war crime and a targeting of civilians. But the rules of war don't say that the suspicion of presence of militants in a hospital allows an army to destroy that facility or consider it a legitimate military target. There has to be a consideration of the presence of civilians, the presence of patients, and really of the proportionality of the attack to the military goals of it. And this is where what we're seeing in Gaza is really just indiscriminate attacks on all facilities, completely destroying the ability to ensure healthcare for the civilian population in Gaza.
Yeah, I'm reading some of the report. It isn't so much about just the attacks themselves, but how ambulances and emergency teams have been impeded from reaching people who are wounded and obstructed during hospital evacuations, including UN teams.
That's right. And part of it also is that doctors have been arrested. They've been imprisoned without charges. And these are other ways in which the healthcare system is being targeted. In addition, the basic determinants of health are also being targeted with attacks on water sources, with the siege that's occurring right now, not allowing humanitarian aid to get into the country.
These are profound issues, and the stories about malnutrition, starvation, inadequate access to food and water are extremely difficult. And like many other reports in this overall assessment, raise profound questions of adherence to international law. I guess a question that comes naturally to reading this report is what can be done? How are human rights laws enforced?
Well, human rights laws are enforced partly by increasing awareness of what the law is and how actors, military forces, and militants should engage. It's also can be enforced by sanctions and can be enforced by putting those responsible in the International Criminal Court and trying them for violations of international humanitarian law.
How has that process gone? How does it relate to what you found in this report?
So there hasn't been a real strong example of accountability for attacks on health. And that is something that we're trying to change with greater awareness, with a demand that countries both train their forces on international humanitarian law, but also hold their forces accountable as a first step. Because ideally, if the parties that are engaged in the conflict recognize what the rules of war are and identify who's responsible on their own side, they can take the steps to make sure that there's accountability in their forces and it doesn't necessarily have to escalate to the level that we're seeing today.
What is the most important thing that those who put together this report want the world to know?
That we have to stop this trend. I mean, we're seeing a 15% increase this year compared to last, and last year was a horrendous year for the amounts of attacks on health. We're also seeing massive impact when you target vaccinators in northern Nigeria, for example. When you target and eliminate 90% of the hospitals in a country, you have this national impact on health status. And so we have to do this because it's the right thing to be done. We have to do this because conflict is going to occur, but we can try and make it more humane than it is.
Let me ask you this question. Attacks on healthcare, as you said earlier, may sometimes be justified if there is specific evidence of the use of a healthcare facility by an army and there's a proportionate response. Are there similar circumstances where a restriction of food or water for an entire population can be justified under international law?
No. Essentially, the answer to that is civilians shouldn't be targeted. Things like water supply, sewage are not military objects to be targeted. And when you get into a situation where you have mass killings, where you have intent, where you have a systematic effort to push a population out of their community, you start to fulfill the requirements of crimes of extermination, which is a specific act of a war crime. And so these things all should be off limits.
Professor Joe Amon, thanks so much for joining me.
Thank you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Fernandez-Ciceri. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Social media run by Grace Fernandez-Ciceri. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.